Welcome back to the Lars Larson Show. It's a pleasure to be with you, and I'm glad to get back to your phone calls and emails. We'll do that shortly. But I want to tell you about something crazy that's going on right now. China virus arrives on our shores back in January, and the President of the United States says we're going to launch a massive federal effort to help the private pharmaceutical companies come up with a vaccine in record time. And back in January and February and March, every doctor I talked to said, oh, it's going to take 12 to 18 months, and that's optimistic to get to a vaccine. They all said couldn't happen within a year. Just simply cannot happen. Well, it appears that we're right on the cusp of finding out that a number of these companies may actually have a working vaccine. Now, one is probably going to be better than the others, and they're in final trials, or they're in some of the trials that have to be done before it's finally released. And then along come a number of states, blue political states, that have said, well, we don't trust the pharmaceutical companies. We don't even trust the FDA and the CDC. We will do our own. We will go to court and we will demand that we do our own vetting and evaluation of the vaccines before they are released to our residents, the people who live in those states. I think that's a crazy idea, but then I'm not a doctor. Dr. Kevin Pham is a medical doctor, and he's a policy analyst at the Heritage Foundation. Dr. Pham, welcome back to the program.
Great to be back. Thanks for having me.
What do you think of the idea that several states have now said, even after the FDA says the vaccine is good to go, we're going to go back and, I guess, go through months of records, thousands or tens of thousands of pieces of data, and we're going to do our own evaluation at the state level of whether or not the vaccine can be trusted? Is that sensible?
No, I find that completely insane. This is going to be, in the time of a public health emergency, which I'm pretty sure we all agree that this is, the idea is not to add increased duplication of efforts. What they're going to be doing is redoing all of the work that's being done, not just by the pharmaceutical companies, but by the FDA as well. And they're going to be doing this extra, and then they'll just add the amount of time it will take for an actual vaccine that already works, that we know works by that point. They'll be adding more time for it to get to their residents. And so it makes zero sense whatsoever.
Well, and in fact, do the states even have access to the kind of intellectual resources it would take to do that? I mean, let's say I came to you, Dr. Pham. I mean, you've worked in medicine for a time. You're a policy analyst. If I threw this giant stack of paper on your desk, or probably more likely in electronic form, said, here you go, Doc, here's the last 3 months of testing we've done on tens of thousands of people. Why don't you reevaluate it and see if the FDA goofed anywhere? Would the states even have access to that kind of intellectual horsepower?
Maybe a larger state would be able to, if like California decided to hire a bunch of people, and I'm sure they can get like probably the universities involved. But that is still a lot of manpower, and then organizing all of that is going to take time. And this is time that was basically already spent by the FDA, and they're just going to be reduplicating this effort, and it's not going to be necessary.
How much of a delay do you think that if they really did what they're proposing to do, and I'm not making this up, it's not a hypothetical, it says several states have vowed to conduct independent reviews of any COVID-19 vaccine, but the top health officials say such vetting may be misguided. The states include Oregon, California, New York, District of Columbia. They all say that they're going to do their own independent vetting. If they really did that, how much time would that likely take just to go through the paperwork produced by all these vaccine trials? Any idea?
If they're going really quickly, maybe a month. That's assuming that they've recruited a lot of people into the effort and the recruitment happens like right away. But more than likely, if they actually go through all of this data with a reasonably sized team, it's probably going to take 2 or 3 months to sift through it, run the analysis, and to verify their data.
So, Dr. Pham, what would be the implications of saying we have a vaccine ready, but because you live in one of these half a dozen states that says they're going to do this, it's going to be held up for an extra month, 2 months, 3 months? What are the implications for that in terms of people getting sick because they don't have the vaccine, people going to the hospital, and people dying?
Right. In most of these states, most of the country is seeing a fairly stable number of cases. That's fairly low. It seems to have increased a little bit in the past couple of days. But you're going to see transient increases and decreases in cases. But a number of those cases probably will be preventable if they had a vaccine that was broadly available that's not being held up by the state government. So, ultimately, I don't think it will have that much of an impact. And people who get the disease after a vaccine is available, most of them will end up recovering, and then they'll have the antibodies anyway. But there's a risk that some of these people are going to develop a more severe disease that may linger, or some of these people may die, and it's just being held up for no good reason.
Well, when you say it's a stable number, Doc, I understand stability, I guess, depends on where it is, but aren't we still looking at about 500 deaths per day? And we're talking about tens of thousands of cases per day that are occurring right now. That's the stable number you referred to, right?
Right. So by stable, I don't mean good. By stable, I just mean it doesn't seem like it's spiking at this time.
So, for example, I think in the last 24 hours, the latest numbers are 42,553 more cases. So if you have 3 more months when you could be vaccinating people, and instead every day you have 30 or 40,000 cases a day, and we're looking at 500 deaths a day from this disease, that's quite a death toll. It's quite a sickness toll if you delay it by 2 or 3 months.
Right. We're talking potentially several hundred. At least with deaths go, we are learning better how to handle this and to decrease the mortality. But as far as cases go, if you're talking up to 3 months, we're talking about close to 150,000 new cases that obviously you wouldn't be able to prevent all of them. But how many of those would you be able to prevent if you're not holding up a vaccine?
Well, and let me ask you this. From a legal standpoint, do the states even have the legal authority? If the FDA says the vaccine is good to go, and a doctor in Seattle or a doctor in Portland or a doctor in New York says, I want some of that vaccine, does the state even have the authority to block the doctor from taking an FDA-approved vaccine and applying it to his patients, if with their consent, of course?
Now, I don't have the full legal picture. We have a lot of people at Heritage who are better at that. But the states do have very broad authority through their pharmaceutical boards, through their health department, to block drugs. We saw this earlier in the pandemic when the states blocked the use of hydroxychloroquine for any indications of COVID-19. Right, exactly. And so they could be doing this. And then further, a lot of these vaccines are going to be distributed by the federal government through Operation Warp Speed. So they're probably going to go through the state government first. And once the states have it, then they can hold on to it if it's in their possession.
But Dr. Pham, you literally could be in a situation where because you live on one side of a state border, you could be told, I'm sorry, you can't have the vaccine. Your governor says you can't have it, but it's going to people right on the other side of the state border.
Right. It's going to be a completely arbitrary delineation, and it's a health decision that's being made at a government level rather than at the clinical level.
Can you imagine what Americans' reaction to that is going to be? What do you mean? I live in Pennsylvania. I can't get the vaccine, but I could get it in Connecticut?
Right. It's preposterous. And again, this just goes back to the work will have already been done. So why are the states doing this just to hold up a vaccine that could be life-saving?
Any opinion on that? Politics, maybe?
Yeah. There's been this really bizarre push to say that, we don't trust Donald Trump. We don't trust his vaccine. It's not his vaccine. The pharmaceutical companies, they do want their product to work. They want to look like they have a good product. And the FDA, we talk about this bureaucracy that exists beyond presidential terms.
I couldn't agree with you more. Dr. Pham, thank you very, very much. That's Dr. Kevin Pham from the Heritage Foundation, also a medical doctor. Is your governor going to hold up your vaccine?